In this video, I'm going to show you how to fix shin splint pain in 30 seconds. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to focus on medial tibial stress syndrome, commonly known as shin splints. If you're unfamiliar with shin splints, it's where pain and tenderness forms on the inner part of the lower leg towards the shin bone, also known as the tibia. It usually comes about from weakness and tightness in the muscles that support the lower leg. These include the tibialis anterior, the tibialis posterior, and the calves. To make this easy, I'm going to break the video up into 3 separate parts. In the first part, we're going to focus on soft tissue tightness. Then we're going to focus on lengthening the muscles, and then finally strengthening them. All parts work just a little bit differently, so to get the best results, go through all of them, use what gives you the most relief. As a bonus, all of these exercises can be done at home, require no special equipment, and you may find give quick shin splint pain relief even within 30 seconds. So let's get started and fix those shin splints for good right now. In this part, we're going to focus on getting quick pain relief by focusing on tightness, tension, and stress in the muscles and the soft tissue. This is known as gua sha or muscle scraping, and it can give relief within seconds. We just need a couple of things. The first being a form of lubrication. I'm going to be using coconut oil massage lotion, but you can use any muscle or massage lotions or creams that are designed to be put on the skin. Next, we need a large metal spoon. You want one with a little bit more thickness to it, you'll get better results. Start off by coating the whole bottom leg right here with that lotion or cream, pretty much from the ankle to the knee, on the outsides, front and back. We're going to focus on everything. So let's start by finding our contact point. If you take 2 fingers and pinch on the long bone of the leg right here, that's the tibia. What I want to do is pretty much pinch on that bone and start to work my way downwards. When it comes to shin splint pain, generally it's at the bottom third of the leg, the distal end right here. So as you pinch inward, right here on the medial aspect of the leg, you'll probably notice discomfort, pain, possibly even lumps over that muscle and soft tissue. Those are the spots that we want to make note of. So what I'm going to do from there is take my thumbs right here and start to do a circular massage right into those lumps or discomfort. I do this for about 10 to 15 seconds, relax, and then repeat this 3 to 5 times or until they break up. You can also experiment with different motions. So instead of doing circular motions, you can do long strokes like this, up and down. You can do side to side. If any of those work better, use that. But I try to do that pretty much from my ankle right here, working my way up towards the knee, addressing any spots that feel like it needs it. And definitely do this over the calf too, and then the other side of the leg right here, finding any spots of discomfort. If you are having pain directly over the tibia, like it just feels like it's right in the bone, I do recommend consulting with a local doctor because it might be possible that you have a stress fracture or you are beginning to form one, and you definitely want that to be addressed. So afterwards, if you feel like those pockets of tightness and pain are just not releasing, we're going to take it to the next level by using our spoon, and we're going to do what is known as muscle scraping at this point. So with the spoon, it doesn't matter what part you use. You can use the rounded portion, the handle, the tip. Experiment with it. Any portion that works a little bit better for you, use it. I like to use the handle and the tip. So what I'm going to do is put the spoon roughly at about 30 to 45 degrees. I'm going to press into that soft tissue. We are going to avoid going over any bone. Only go over skin and soft tissue. And I'm going to apply enough pressure where it's going to be a nice self-massage, and I'm going to scrape or glide upwards. This right here can become very intense. So again, only to your comfort level. I'd like to go over one spot for about 5 to 10 times. From there, I give it a little bit of time to relax, and you can do this another set or 2. And then from there, what you're going to do is work your way up. Again, going from the ankle all the way to the top of the knee, hitting the calf muscle right here, go on the other side of the leg. All of these muscles right here, they work together, so make sure to focus on all of them. But afterwards, if you feel like you need a little bit more tension, you can then take it at different angles. So instead of going straight up with it, go at the side right here. But I do try to stroke upwards towards the heart with this method right here. And experiment again with using different parts of the spoon, and if it feels like it works a little bit better, definitely go with that. Afterwards, what I'd like to do from there is put the muscles into different positions to hit the muscle fibers just a little bit differently. So what I will do is bring my foot back towards me, engage those muscles, including the calf right here, and then repeat this process. You'll notice that it hits the muscles just a little bit differently. So point your toes away from you, do it. Bring the toes back towards you. You can put your foot inwards, outwards. Any movement that you feel causes discomfort and increases shin splint pain, you want to build into that motion and then repeat this process until you feel that soft tissue start to release. But it's just a great way to really get in there, knock out soft tissue tightness, and get very quick shin splint pain relief. In this part, we're going to focus on a lengthening stretch that will help take tension and stress off the muscles that might be associated with your shin splint pain. This is known as a kneeling stretch. It's very easy to do. It's best done on a floor, but if your mattress is firm enough, you might be able to do it in bed. So what I'm going to do is start off on my knees like this. Our legs are going to be roughly hip width apart. I want my toes pointed straight away from me. Once we're in that position, what I'm going to do from there is slightly turn my toes inward, and then I'm going to lower my body downward towards my heels, kind of like taking my bottom towards my heels. The more that you go down, the more that you're going to feel a deep stretch forming in the front part of the leg. This one really targets the tibialis anterior muscle right here on the front part of the leg. Only go to your comfort level. If you're not able to touch your heels, do the best you can. You want a deep, comfortable stretch. Hold this one for 15 to 20 seconds. When you need to relax, come back like this. I try to do it for about 3 to 5 repetitions, and with each repetition, I focus on driving my body weight down just a little bit more to help lengthen that soft tissue. If you want to take this one to the next level, because you're just not feeling a deep enough stretch, what you can do from there is then go with your hands, kind of put them right in front of you like this, keeping your toes pointed down and pressed down into the floor of the bed, and then lifting up on your knees like this. And this becomes a very deep stretch into the front part of the leg. So give that one a try. Again, a 20-second hold, relax, repeat this one 3 to 5 times, build into it just a little bit more with each repetition. So if your goal is to not only get pain relief, but get rid of shin splints for good, your best bet is to strengthen the muscles associated with it. I'm going to go over a strengthening exercise that's going to target the calves and the tibialis posterior. This one is best done on a staircase. So what I'm going to do is step up on a stair just like this. The ball of my feet are going to be on, my heels are going to be off. Let's start with a basic calf raise. And if you do have balance issues, you might want to go next to a wall also so you can grab onto it if needed. So what I'm going to do is just drive my heels upward towards the ceiling as much as I can, really focusing on activating and firing those calf muscles. You want to hold this for 5 seconds. From there, I'm going to slowly come down and allow my heels to go down towards the floor, but I'm going to fight my body weight as I do it. It should take about 5 seconds. You'll notice that this hits the muscles just a little bit differently. When you can't go down any further, then you're going to come back up and do that calf raise. Do this nice, slow, and controlled for about 10 to 15 repetitions. And with each repetition, challenge yourself to build into it just a little bit more. If you feel like you have a little bit more energy, you can throw in another set or 2. From there, I like to do what is known as an eccentric. So instead of going straight up and down with it, I will put my body in a different position and angle to target the muscles just a little bit differently. So swing off to the side like this. When you come down, also swing down just a little bit. You can do circular motions. Keep those muscles guessing because it will challenge them and really focus on strengthening them through different motions, dynamic movements that is. And also, if you do have one certain movement that really just sets that calf pain off, like let's say going towards the right for me, throw more repetitions in. You always want to focus on building into motions that feel weak or are causing discomfort, because over time you will strengthen those muscles and tendons and hopefully eliminate that pain. But do this whole cycle right here for 10 to 15 repetitions, and you can throw in a couple sets. And if you do think that one spot needs more attention, throw it in. And if you do want to take this one to the next level, do this one leg at a time. Just make sure whatever you do on one side to do on the other to keep them both in balance. So after working on the calf muscles, I like to put a little bit more focus on the tibialis posterior. This one is pretty similar to the calf raise, but what we're going to do is put a tennis ball in between our heels. You can also substitute it for a handball, anything that is round and soft. You could probably use a dog toy if you have one laying around. What I'm going to do, just put it between my heels, squeeze into it until I start to feel the muscles start to activate in the front part of the leg. From there, I'm just going to lift upwards with my heels, putting all of my body weight onto the ball of my feet. Lift up as much as you can. When you do this, you should feel that tibialis posterior muscle firing in the front part of the leg. Hold this one for 5 seconds. You're going to slowly come back down, relax, and then repeat this one 10 to 15 times. If you feel like you have a little bit more energy, throw in another set or 2. To take this one to the next level, you can do an eccentric movement. So instead of going straight up with it, go off to one side and really focus on challenging those muscles in different directions. And if any of those directions feel weak, tight, or painful, throw more repetitions in at that point. So moving on, we're going to focus on the tibialis anterior muscle. What I'm going to do is go next to a wall for this one. You want to put your feet out in front of you, angle your body slightly. With this exercise, the more that you put your feet further away from the wall, the harder it will be. So start off by putting them further away, and at that point, if you feel that it's too hard, just slide them back until you find a spot that you are comfortable with. My legs are going to be roughly hip width apart. I'm going to keep my knees straight and locked during this exercise. We want our glutes or our bottom flush against that wall. What I'm going to do is keep my back straight and then hinge and pivot forward through my waist until my shoulders and my upper back are not touching. I'm going to put all of my body weight onto my heels and then slowly raise my toes upward towards the ceiling. The more that you go up, the more that you're going to feel that tibialis anterior muscle start to fire right in the front part of the leg. You want to activate that muscle, hold this one comfortably for 5 seconds, and then you're going to slowly come down, fight your body weight. It should take you about 3 to 5 seconds until the ball of your feet touch the floor. You can make this one more challenging by not letting the ball of the feet touch the floor. Just let it hover and hold that for a couple of seconds. But you want to do this whole process for about 10 to 15 repetitions, just nice and slow. And with each repetition, build into it just a little bit more. Focus on challenging those muscles. And if you feel like you have a little bit more energy, you can throw in another set or 2. If the exercises helped, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.